Let's first get a better understanding of bursitis. In order for the bones in our joints to glide smoothly as we move, our body has small, lubricated sacs called bursas located around moving joints throughout the body. These sacs contain a small amount of lubricating fluid known as synovial fluid. The normal space inside a bursa contains just enough fluid to allow the surfaces to glide across each other with very little friction. However, due to injury and resulting inflammation, a bursa sac may fill with fluid and can become extremely painful. This condition is medically known as bursitis and may result from a sudden impact or other trauma to the joint, a repetitive stress or overuse of a joint, an age-related weakening of the joint, or one of many other underlying conditions such as osteoarthritis. The Osmo patch has been developed as a 100% natural alternative to anti-inflammatory drugs, steroids, and other painful or invasive procedures, such as draining the area with syringes. Let's now take a look just how easy the Osmo patch is to use for the relief of swelling and pain associated with shoulder bursitis. Just before you go to bed, place the Osmo patch directly over the area of inflammation or pain. The patch can then go to work while you sleep. Firstly, the tourmaline in the Osmo patches stimulate the sympathetic nervous system, which then induces sweating under the patches. We call this activated sweating. Highly absorbent natural materials inside the patches quickly take up the sweat from the skin and into the patches before it has the chance to evaporate, therefore blocking the thermodynamic cooling effect from taking place. This means that while the Osmo patch remains in place when you sleep, the patch will continue uninhibited throughout the night to induce vascular fluid loss in the area directly under the patch. It's here where the natural benefits of osmosis can now begin. This very loss of water through sweating leads to a reduction in the vascular volume and subsequently increases osmotic pressure below the area of the patch. It is the increase in vascular osmotic pressure that now initiates the natural process of osmosis. You see, in order to rebalance the changes in this osmotic pressure, fluid must first shift from an area of low osmotic pressure to an area of high osmotic pressure. Therefore, the accumulated interstitial fluid having low osmotic pressure is subsequently removed from the swollen edematous tissue in and around the bursitis and back into the local vascular system where there is high osmotic pressure. This transition of fluid occurs via the microvascular bed. As the patches are worn throughout the night, they will continue to induce uninhibited activated sweating, leading to the reduction in vascular volume and increase in osmotic pressure. This causes the rebalancing of the osmotic pressure by shifting interstitial inflammatory fluid from the affected tissue back into the vascular system via the natural process of osmosis. This loop can then continue throughout the night until the patches are removed and discarded in the morning. The Osmo patch takes advantage of these completely natural and non-invasive processes found in nature. It's this constant naturally induced removal of fluid from the affected area which results in the reduction of your swelling and associated pain. So, if you'd like to relieve swelling and the associated pain due to shoulder bursitis, then it's time to discover the Osmo patch.